Understanding the Ebola virus: causes, symptoms and treatment. The Ebola virus is a rare and potentially fatal disease that can cause severe damage to the human body. It is one of the deadliest viruses known to exist, having caused numerous outbreaks throughout the world. Understanding the causes, symptoms, and treatments of the virus are essential for preventing and managing its spread. This article will provide a comprehensive overview of the Ebola virus, including its origin, how it is transmitted, its symptoms, and the available treatments. We will also discuss the importance of early diagnosis and prevention strategies. By understanding the basics of the Ebola virus and the steps to take to avoid and manage it, we can all work together to reduce the risk of infection and save lives. What is the Ebola virus? The Ebola virus is a member of the Filoviridae family, the same family as the Marburg and the Ebola-Rhogaviruses. The virus is named after the Ebola River in the Democratic Republic of Congo, where it was first discovered in 1976. As of November 2014, there have been 61 confirmed outbreaks of Ebola and all have occurred in Africa. Ebola has a very high mortality rate and there is no vaccine or cure for the disease. The Ebola virus is a member of the Filoviridae family, the same family as the Marburg and the Ebola-Rhogaviruses. The virus is named after the Ebola River in the Democratic Republic of Congo, where it was first discovered in 1976. As of November 2014, there have been 61 confirmed outbreaks of Ebola. Ebola has a very high mortality rate and there is no vaccine or cure for the disease. How is the Ebola virus spread? The Ebola virus is a member of the species Ebolavirus, a family of viruses found in tropical and subtropical regions of Africa. The virus can be found in various wild animals and can also be transmitted from person to person by direct contact with infected blood, body fluids, or tissue. There are three forms of transmission: direct contact with an infected person's blood, vomit, feces, urine, or other bodily fluids; contact with infected animals, such as monkeys, bats, non-human primates, and chimpanzees; contact with contaminated materials, such as animals, contaminated plants, and contaminated objects. The virus can also be found in semen and saliva for a period of time, making sexual transmission possible. Blood, saliva, and other bodily fluids can be infectious for several hours after a person has been infected. The virus can be present in saliva, urine, and feces for several days after infection. The virus can survive on surfaces for several days. What are the symptoms of Ebola? Symptoms can occur anywhere from 2 to 21 days after infection, though most people develop symptoms between 8 and 10 days after infection. Symptoms can include nausea, vomiting, abdominal pain, diarrhea, low blood pressure, muscle pain, headache, dizziness, rashes, impaired or loss of consciousness. While the symptoms of Ebola are similar to those of many other illnesses, the flu-like symptoms patients report are not typical of the common flu. Symptoms are often flu-like, but they are more severe and can result in death. Additionally, patients often have mild or no symptoms at first, making it difficult to diagnose and prevent the spread of the virus. There is no vaccine or cure for Ebola. How is Ebola diagnosed? Ebola is diagnosed through a patient's symptoms and through a number of laboratory tests. To diagnose the virus, a sample of a patient's blood or saliva is sent to a laboratory. There are two different types of tests used to detect the presence of Ebola viruses in blood samples. Rapid tests detect the presence of the virus in less than 2 hours. Slow tests detect the presence of the virus in 6 to 12 hours. Among the laboratory tests used to detect Ebola are blood tests. These tests detect the presence of antibodies in the blood, showing that a person has been exposed to the virus. Urine tests. These tests detect the presence of specific proteins in urine, which are also found in the blood of people with Ebola. A positive result from the blood or urine tests is generally followed by a definitive diagnosis of Ebola. However, false negatives and false positive results can occur, making it important to follow up with a medical professional if you receive an inconclusive result. What are the treatments for Ebola? There is currently no cure or vaccine for Ebola. The medications used to treat the disease include rest and fluids to reduce the damage to the body, antibiotics to fight secondary infections, such as bacterial infections and pneumonia, anticonvulsants to reduce the damage to the nervous system, blood transfusion to provide enough oxygen to the body, antibiotic treatment to reduce the chances of bacteria such as Streptococcus pneumoniae, Staphylococcus aureus, and other harmful bacteria growing in the body. There are also several strategies being implemented to reduce the risk of Ebola transmission, including cleaning and disinfecting objects and surfaces, wearing protective gear, such as masks, goggles, and gloves, preventing direct contact with infected individuals, such as by not sharing food and water, staying away from sick individuals, and regularly washing your hands. There is no approved drug to prevent, cure, or treat Ebola. However, several drugs have shown promising results in clinical trials for their ability to fight infection. For example, antibodies against a protein that is found in the Ebola virus have been shown to be effective at reducing the risk of Ebola in patients who are given them during treatment. Prevention and control measures. Control measures include preventing the spread of the virus from infected individuals and practicing good hygiene. Cleaning and disinfecting objects and surfaces is one of the most effective ways to prevent the spread of the virus. Wearing protective gear, such as protective gloves, goggles, and masks, can also significantly reduce the risk of infection while engaging in daily activities. To prevent direct contact with infected individuals, such as by not sharing food and water, staying away from sick individuals, and regularly washing your hands, it is important to follow good hygiene practices. Good hygiene practices include washing your hands before eating or drinking only from clean dishes, and disposing of used food and drink in a sealed container. Conclusion. The Ebola virus is a rare and potentially fatal disease that can cause severe damage to the human body. Understanding the causes, symptoms, and treatments of the virus are essential for preventing and managing its spread. This article will provide a comprehensive overview of the Ebola virus, including its origin, how it is transmitted, its symptoms, and the available treatments. We will also discuss the importance of early diagnosis and prevention strategies. The Ebola virus is a rare and potentially fatal disease that causes severe damage to the human body. Understanding the causes, symptoms, and treatments of the virus are essential for preventing and managing its spread.